Hello, and in today's session we're going to take a look at the automated external defibrillator. This life-saving piece of equipment is commonly found now in your shopping centres, in your railway stations, in your airports and even schools. They're a clever device that can understand the rhythm of the heart, recognise when it's not in an appropriate rhythm and deliver a shock to try and help the heart get back into a normal rhythm. So we use these devices when someone is collapsed, unresponsive and not breathing. Now you can see a number of different devices on the table here in front of me. We have the Cardiac Science G3, we have a LifePak CRT. They're different manufacturers, they're different models, but they all work in a very similar way. We do have two key different types, that's the semi-automatic and the automatic. With an automatic, once you attach the device, it will do everything for you, it will tell you what's going on, and if it believes it needs to deliver a shock, it will deliver the shock. Whereas the semi-automatic, you get a final say. If a shock is required, it will tell you and provide you a button that is flashing to press to deliver that shock. That's a lot safer in an area where it's quite crowded and you need to know no one's touching the casualty before you press the button. Whereas the automatics are great in your airports, your shopping malls, where someone who's not trained is probably going to grab it, attach it and let it do its own thing. So let's take a look at the Cardiac Science device. With this particular device, when you turn it on, when you open the lid, it turns it on. You can see here that it's a semi-automatic device because we have a button to press. You can see the pads are included and are already attached and ready to go. You can also see on the device an indicator. Now that indicator, if green, tells you it's ready to go, whereas in this situation it's got red with a cross through it, which means it's not going to deliver a shock, it's not ready for use. If it was flashing between the red and the green, it's warning you the battery's going and it might not work. There's a very easy reason why this device is warning you, as I can show you there, the red cross. That's because there's no battery in the bottom. In case you would have a battery in here. So with this device, it should start to warn you when the battery is dying. You'll hear bleeping coming from the device and you'll start to see it's flashing. So at this point you would need to replace the battery. You do not need to keep spares, just need to order one when it starts to warn you. With your device, you should have a number of items. So you can see in the lid here that I have a pair of tough cut scissors used for cutting through clothing and any jewellery or metal in clothing that might need to be removed. Small cloth as a towel for drying a casualty that's wet before I place the pads. A razor for a casualty that maybe is extremely hairy on the chest and the pads are not going to attach. And then a spare set of pads. Things to be aware of with the pads, they do have a date on them. You can see here on the window here, it lets me see them. They need to be in date because otherwise the glue may have dried and will not attach. And we need to know that the battery is okay. So that's a bit of an overview of the AED. But in most cases you'll be grabbing it from a wall and using it. So let's take a look at how you use an AED. So let's take a look at how we use an automated external defibrillator. So Annie is collapsed here on the ground in front of me. As per any other situation, we're going to follow Dr. ABC. So before kneeling down, I went and checked for danger. So the area is safe for me to be next to the casualty. Then we're going to look at response. Hello, can you hear me? Can you open your eyes? Can you clasp my hand? So I've shaken the shoulders, I've asked them to do something by opening their eyes and clasping my hand. I'm checking for that level of response from my casualty. So in this situation, my casualty is not responding. So as I'm on my own, I'm going to shout for help and try and get some attention to me so that they could then go off and get me an ambulance, get me an AED or other resources that I might need. Having called for help, We're going to look at the airway, so palm of the hand on the forehead, 2 fingers underneath the chin, tip back, and I'm watching for breathing. I'm looking at the colour in the face, and I'm watching for normal breathing with the chest rising and falling. I've not got close to my casualty as I would with previous procedures because we're in the situation currently of COVID-19, and I want to minimise the chance of me picking up the infection if this casualty has collapsed for that reason. So having found that the casualty is not breathing, no one's come to support me, so I'm going to utilise my mobile phone, put it on speakerphone and get myself some attention and emergency services to me. Having called for the emergency services, I would normally get into doing compressions. But I have an AED next to me, so that takes priority. So with this particular type of AED, when you open it up, it will turn it on and it will start to tell me exactly what to do. So at this point, it's going to tell me to go and open up the clothing of the casualty so that we can go and attach the pads. Now, if the casualty has suffered a cardiac arrest and they were sweating due to the heart attack, or you've pulled them out of water, then you need to think about drying the chest. And during this current time of COVID, I'm going to cover the nose and face to add some protection for me. So we're going to dry off where the pads go. We do not need to dry the whole body, just where I'm going to attach the pads. If there's any metal, then I would be, like underwire bra, any jewellery, I'd be addressing that. And then I'm opening up the pads. And you'll see from the pads that they got the diagram exactly where to place the pads on the casualty. So we're going to take the first pad and we're going to place it underneath the arm. The pads on an AED are really sticky, more so than what we've got on the training pads. One underneath the arm, the other one up on the shoulder. Make sure you've got good contact. And then the device will pick up that the pads are in place and will tell you it's analysing and to keep clear. So at this point, my job is to ensure that no one touches the casualty. So I'm asking everyone to stand clear. I'm keeping them up to date with what's happening. The device will then check whether a shock can be delivered to the casualty. And if it can, then it will let me know. It will tell me to keep everyone clear and that I should press to shock. So I'm going to have one last look round, make sure everyone stand clear and press the button. The current will cause the muscles on the casualty to contract and you may see a bit of a jerk. Don't be worried by this. Okay, so the shock has been delivered and the AED will now tell me to start CPR. So we're bringing ourselves up over our casualty and we're looking at compressing at 100 to 120 compressions a minute at a depth of 5 to 6 centimetres on an adult. So the AED will expect us to do that for 2 minutes before it will then start analysing again. It will tell us to keep clear and then it may deliver another shock or it may tell us to carry on with CPR. And you keep those cycles going until you see a change in your casualty and you think you see signs of breathing, in which case do your checks. And if they are, put them into recovery position. And if they're not, we would keep on going with CPR. You may stop if you are exhausted and can no longer safely carry on, although if the device is telling you to shock, you could still be doing that. Or the ambulance arrives and they ask you to stop and they set up their equipment around you. So that's how we follow through on using the AED. The AED takes priority over CPR once it's arrived and we literally follow the advice of the device. So let's see that in action. Hello, can you hear me? Can you open your eyes? Can you clasp my hand? Help!
Call for help now. Remove all clothing from patient's chest. handle to open bag. Look at pictures on pads. Peel one pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Do not touch patient.
Everyone standing clear.
Evaluating heart rhythm. Stand by.
Everybody stand clear.
Preparing to shock. Everyone clear. Press flashing button.
Everyone stand clear.
Shock delivered. Provide chest compressions and rescue breath. Continue care.
So you've got to see the AED in practice. So there's a few things you just need to consider about the AED. So we've talked about when you first approach your casualty, if they're wet, then you need to think about drying the area where the pads are going to go. You don't need to dry the whole patient, just where the pads are. You need to think about any jewellery. So if I had a necklace on and my pads are going here, then there's a risk that it's going to have contact with the jewellery. So make sure that necklace is out the way or it's removed. For ladies with the underwire bra, then that needs to be removed again so the pads are not connecting with it. Which is why in the kit we have our tough cut scissors, which are designed to cut through clothing and small elements of wire. You need to think about any medical patches. So if you detect any medical patches in the areas that the pads would be going, then you need to be removing it and putting it somewhere safe, because we don't know how that will react with the shock as it goes across, because we don't know what chemicals might be in it, so it's safer just to remove it out of the way. If your casualty has an internal pacemaker or defibrillator, well, if they're lying on the floor, then they haven't worked. So you'll know those by a lump that's up on the chest and a scar where they've been inserted. So if I was putting my pads on my Annie and there's a lump here, just make sure that the pad is moved away from it. You do not want a pad that's going over the top of an internal pacemaker or defibrillator, so just move it further away. You may find when you put the pads on, if someone's really hairy, that they don't get a good connection, at which point you've either got to shave the areas where the pads are going before you attach, or if you attach and the defib is telling you to check pads because of an issue with the connection, then you can pull them off, give them a free wax, and then put a new set of pads on, and hopefully that will resolve your connection issue. The other one to think about is if your casualty was on oxygen before they collapsed, or you're working with a first aider who knows how to use oxygen, make sure the oxygen is behind you, out of the way when you deliver the shock. Do not have oxygen near the casualty when a shock is being delivered. So there's some of the things you need to consider when using an AED. But AEDs are really simple to use. They talk you through exactly what to do. So don't be frightened of using one. If you see someone collapsed, they're not breathing, get that AED on that casualty and save a life. In the next session, we're going to have a look at first aid equipment you might find around the home.